Welcome to Be Well, an It's Okay podcast designed to promote and support mental, financial, physical, and social well-being. Be Well provides insights, tips, and strategies for enhancing all aspects of well-being through conversations with experts. Whether you want to manage stress, improve your financial health, boost your physical well-being, or enrich your social relationships, this podcast is a go-to resource.
Welcome to the Be Well podcast. I'm your host, Kate Fisher. Before we get started, I have a few words, a little disclaimer. Today's discussion is for educational purposes only. Any medical or healthcare decisions should always be made in consultation with your personal healthcare provider. Cummins does not endorse any specific therapies or providers. Our goal is simply to give you good general information to help you make informed decisions about your own health. With that, today we're diving into a topic that affects so many women, all women really, but especially those of us in our mid-30s and beyond, and that's women's health, hormones, and metabolism. These are conversations that are long overdue and honestly deserve attention. And there is no shortage of this information online about women's health. If you spend even 5 minutes on Instagram or TikTok, you'll quickly realize how hard it is to tell the difference between clinically supported facts and the latest wellness trends. And so our goal today is to cut through that noise. This isn't about promoting any specific treatment or approach. It's really about giving you clear science-backed information so that you can walk into your next appointment with your healthcare provider feeling informed and empowered to ask the right questions. And to help us do that, today I am joined by someone who has spent nearly 2 decades in this space. Dr. Nicole Bassa is a board-certified, fellowship-trained bariatric surgeon based in Austin, Texas. Dr. Bassa specializes in metabolism, weight management, and hormone health. And for the last 19 years, she's been in private practice alongside her husband, taking a comprehensive and multidisciplinary approach to helping patients navigate weight management. Dr. Bassa, welcome to the podcast.
Thanks, Kate. Appreciate it.
So we'll just jump in here. When we talk about women's health and specifically hormones, there can be so much confusion, particularly around weight gain. So as I mentioned, you can go on to Instagram or TikTok and there are unlimited videos talking about this. But I'm not sure, I don't think there's a lot of clarity about the correlation between hormones and weight. And so can you help us clear some of that up?
Yeah, absolutely. So starting off to what's important and what we do in our practice actually is we check a thyroid panel. Definitely thyroid helps provide you with metabolism. So if you're low on thyroid, and that right there is something to kind of bring up is, you know, your primary care might run a regular thyroid panel and say everything's normal and it's within range. But one thing that we don't realize as patients is that the reference range is actually composed of people who are sick and not feeling good and people who are great. So your range for TSH, T4, T3 is a big range, and it should be thought of as a bell curve, meaning, you know, you have the lowest 20% of people at the lowest mark on their thyroid hormone, and then you have the top 20% who are at the top part. And so one specific measurement that everybody should look at is T3. T3 is active thyroid hormone. So if your T3 is in that bottom 20% of that range, then you should get supplemented. And your metabolism slows down if you have low thyroid function. So number one, checking your thyroid for metabolism. And some signs and symptoms for thyroid. If you have a low thyroid, is you feel cold easily, you're sluggish throughout the day, you need to drink coffee all day, especially the afternoons. It's just hard to stay awake. You're just really tired. So those are all signs and symptoms of potential low thyroid. Other things to check is, especially as you go through your 30s or 40s as a woman, is making sure that your testosterone levels are good, your progesterone and estrogen levels, because actually testosterone drops in our 30s, and testosterone is really what fuels our muscles, our ability to build muscle. And muscle is really the metabolic engine in terms of, helping us lose weight or maintain a healthy weight.
That's super interesting because testosterone, I think, is the one. I think we hear a lot about estrogen and progesterone, but not a lot about testosterone. But that leads me into my next question.
Yes.
About muscle and metabolism, and how does perimenopause play into all of this? What happens over time?
Yeah. So as we go into perimenopause, with testosterone dropping, our muscles start to go down. And actually, 3 to 8% of your muscle volume drops every decade after the age of 30.
Wow.
So, yeah. So already, and muscle is the biggest metabolic engine of our body. So if you're losing muscle, what's happening? You start gaining fat. And actually, when you drop testosterone, and then as you drop in estrogen actually is a powerful hormone for our bodies, because as estrogen drops, we start having an increase in insulin resistance and incidence of diabetes. And one of the first things that we start to see is fat around our visceral organs. So you start to have fat around your abdomen and midsection. And so really checking even early on, even in your 30s, checking testosterone, and making sure you get the right levels. And that's the thing. I see a lot of patients in the office who say, oh yeah, everything's normal. My primary care checked thyroid, they checked my hormones, everything's normal. But there are specific things, especially in testosterone, you need to check not only free testosterone, but sex hormone binding globulin, and total testosterone. So total testosterone is one number. Sex hormone binding globulin, some of that testosterone is bound, so it actually doesn't go to your cells. So really the number of free testosterone is what you need to check in women. And women actually make more testosterone in our bodies than estrogen, which
That's
is
crazy. I had
yeah,
no idea.
yeah,
Not
yeah,
even in I'd heard of a little bit on, Instagram, but then even
yeah,
until I talked to you a few weeks ago, and it really made
yeah,
me say, wait, this isn't getting the attention that it needs. And
yeah,
you I think you've mentioned why, what happens with muscle, but what happens with women as they age? Because I think women I've heard
yeah.
I have heard for the past couple of years is women really need to strength train, right? That and eat a
Yes,
lot of
yes,
protein and
absolutely.
strength train. But
Yeah.
I don't know that we say why this is so particular for women.
Yeah, so because of that drop in testosterone, we have muscle loss. And so, how do you actually maintain your muscle or gain more muscle is, making sure you have the substrate, so protein. So, I generally tell most of my patients at least like 80 to 100 grams of protein a day. And when you think about it, one chicken breast is about 25 grams of protein. So, you need to eat like 3 or 4 of those a day. Uh,
Oh, I
yeah,
understand this dilemma. Yes.
yeah, yeah. So the protein, and then doing some sort of resistance training, just like you mentioned. You
Yeah.
need to maintain your muscle. And I think we're so into cardio as women. We do
Mhm.
aerobics, we do
Yep.
running, we do treadmill, we do bicycle, Peloton, stuff like that. But we don't do resistance training. And that's really
Yeah.
what's important to maintain your muscle and maintain your metabolism
Yeah.
as you
And I'm
age.
assuming, and we didn't talk about this before, but I mean, in maintaining that muscle, I mean, that's what's really important to balance and bone health and, you know, just being mobile as you get older. And I think, I don't think there's enough attention on the importance of that. So I say this as though
Exactly.
I do these things, and I don't. So but I'm
Yeah.
going to after talking to you today.
Yeah,
So yeah,
yeah, for sure.
that's it. That's it. Um, so we also hear a lot about, broken metabolism that doesn't work. People have said to me, yeah, I've had conversations over the years, about people saying, well, is your metabolism really working the way it needs to? And I think a lot of women feel like they're doing everything right, but they're not seeing results. And I want to caveat that with there are women across, different generations that, I grew up in the generation when you weren't supposed to eat any fat and you just did cardio till you were blue in the face, right? And it's
Right.
hard to unlearn some of these things. So, but are there really cases where people can be doing everything that they're supposed to do and they're still not seeing an impact on their weight?
Absolutely. So I see it all the time when I see weight loss patients, when I see bariatric surgical patients in the practice. Basically, they're typically expert dieters. They know exactly what to do. They've
Yeah.
done it so many times. And the problem is we're fighting what's called our set point weight. And our set point weight is a weight that our body just likes to be at. So it's not when you're dieting, it's just when you're eating, if you're hungry, stopping when you're full, just eating regularly. Our weight kind of generally sits around 5 pounds up or down. So if you go on vacation, you splurge, you maybe gain like 5 pounds when you come back, but then your metabolism actually speeds up so that you can, once you get back to your normal situation, your weight can go back to its set point. When we lose weight, the problem is our bodies are actually better at gaining weight after we lose weight than actually losing weight when we gain weight. So when you lose weight, your body is not liking that. It doesn't like that it's at a lower level than your set point. And so what's happening is your metabolism slows down, so you don't need as much calories at this lower weight. And then there's release of hormones that make you have cravings. The best thing to gain back weight is fat and carbs. So bread and butter, chicken Alfredo, stuff
Yeah.
like that is the best way to gain that weight. And guess what? You crave those things more. And so what happens is your body bounces up, and a lot of times it goes higher than that. And then you do the next diet, you lose weight, you bounce back up, and it goes higher than that. And you keep on doing this up and down. Before you know it, you really don't need that many calories to maintain that higher weight because you've done this yo-yo so many times and your metabolism has slowed. And actually, studies show that with weight loss, your body doesn't forget the set point for over 6 years. So even though you lost the weight
Yeah.
and you've been good for about a year and stabilized, your body is just waiting for that moment to gain that weight back because your body has that
Crazy.
fixed set point.
See, and these are things that I think I always heard and thought were, when I think about what's real and what's not, I never really thought that was true, but now I'm hearing it from you,
Yeah.
doctor.
Oh,
So
yeah.
yeah, that's crazy.
I
That's
I see it all the time, and I see patients who are like 100 pounds overweight, and then I ask them what they eat, and they really don't eat too much, maybe 2,000 calories a day. And they mention that their spouse realizes like, why are you so heavy and you barely eat that much food? And it's just because of that metabolic yo-yo. So the more diets you do, where you lose, gain, most likely your metabolic rate has suffered from that. But I
and
think that, yeah, go ahead.
well, I was gonna
Sorry.
say, yeah, and this, I'm going a little bit off of the questions, but like,
Yeah.
do you think can people fix this? Like, but you say it takes 6 years. So let's say you make
Yeah.
the lifestyle, whatever
Yeah.
method you get to, and you
Right.
maintain it for long enough, eventually your body can reset that set point.
Yeah.
Okay.
So the key thing is to check your body composition, number one. And
Okay.
so something we have in our practice is called a Sika scale. And that basically tells your muscle, your fat, it can estimate your resting metabolic rate. And then we have something that is called indirect calorimetry, where you breathe in oxygen and you blow out CO2. So it can give you a calculation of how many calories you need in a day.
Okay.
But focusing on building that muscle can help build up your metabolism. And, one thing with bariatric surgery actually is it helps to reset that set point. And there's a lot of studies to show that you're able to cut down that 6 year time frame to a year. And actually at a
Wow.
year, yeah, you're actually
That's
able
crazy.
to reset your set point, where it would be almost impossible if you didn't. So
Okay.
for,
And I
for
actually have a question about that I'm going to come
yeah,
back to before I lose the order the order in
yeah,
which I
yeah,
do this. But
sure, sure.
one thing I do want to ask you about metabolism is, you know, when we think about sleep, and as we get older, especially as women, I can attest to the fact that sleep is a little harder to achieve the way I used, I don't sleep the way I used to. And stress, and I say this too because we hear from a lot of women, especially in our employee group. We have a sandwich generation of people, and women in particular, who are, the stress load is high. They're still caring for their kids, and then they're caring for their parents, and they have all this, they just have a load of stress on them. So,
Sure.
how, when you think about sleep and stress, do those impact your metabolism really? And are there things you can do to sort of offset that?
Absolutely. So stress and not getting enough sleep at night is one of the things that increases what's called cortisol, or your stress hormone, which can then lead to insulin resistance and difficulty in losing weight. That's one test that you can check as a cortisol level, but also what can also affect your sleep is low progesterone. So that's another thing that, like in your 30s, 40s, your progesterone could be low, and taking progesterone, micronized progesterone at nighttime, can help solve those problems with
Okay.
sleep, because it's a normal
Okay.
thing
Yeah.
as women age that
Yeah.
sleep gets affected.
Yeah.
So
Well, and,
yeah,
and one of the questions I know, and I think that I think you've sort of answered, but I want to make sure I heard it right. Like, the questions about, like, what are the things that someone can do that has the highest impact in their lifestyle habits? And I think I'm hearing, you know, building muscle and
yes,
doing and through strength training, through eating the right amount of protein is really important. But figuring out how to manage stress and reduce your cortisol are really important. And then getting those
absolutely.
hormones checked to really
Right,
understand
for
what
sure.
needs fixing. So those sound
Yes,
like the three biggest areas.
absolutely.
Okay.
Absolutely.
So one of the other things, so as you were talking about, um, sort of having a set point and struggling through metabolism, one of the things that is probably incredibly prevalent, whether you're on social media or reading the news, are GLP-1s, right? Everybody's talking
Yes.
about them.
Yeah.
Can you just tell us a little bit about what are the mechanics of a GLP-1? Like, what is it, and why does it impact the body the way it does? Like, why does it actually cause people to lose weight? And is it causing them to lose weight, or is it causing them to eat less?
Right. Okay. So GLP-1, which stands for glucagon-like peptide 1, is actually a hormone secreted from your small intestine. And so when you eat a meal, your body normally releases GLP-1 into the bloodstream. So what does GLP-1 do in the body is it goes to receptors in the brain to tell your brain to tell you that you're full. It also goes to receptors in your stomach to delay the emptying of food from the stomach. And then it goes into the pancreas, and it basically increases the release of insulin. It also either speeds up or slows down your GI tract. So either diarrhea, constipation. So what a GLP-1 receptor agonist, which is like, semaglutide, tirzepatide, that medication, instead of your body's GLP-1 binding to those receptors, that medication binds to those receptors throughout your body. And it actually is, and I've seen some studies say that it's almost 200 times more potent than your own body's GLP-1. So what does that mean? So that means you just don't really want to eat. It's super important if you do decide to go on a GLP-1, that you have the basics in place, meaning making sure you drink enough water, making sure you're eating protein, making sure you're doing some resistance training, because definitely if you cut off that impulse to eat and you feel full all the time, you're really not going to eat that many calories. And so you really have to almost force yourself to eat. Because
Yeah.
if you don't do that, then you lose not only fat, but you lose a lot of your muscle. And that's why it's super important before starting one of these medications to really see a physician who will follow you. I think it's easy to get it online and you just start taking the injections and you don't really realize what's actually happening in your body. You may see the scale go down, but if it's mainly muscle, you're actually getting less healthy than more healthy. And I think that's super important for people to know before they just start taking it.
Well, and that's really important. I think one of the questions that I have is when you think about the risks or trade-offs that people really need to know about before they take that. I mean, yeah, we cover GLP-1s, and so we've tried to put some tools in place that give people the opportunity to learn about them. But and we know GLP-1s are relatively new on the market, and that there are not super long-term studies. But are there other like risks or trade-offs that you would tell somebody that they need to consider? And what are some other alternatives? I mean, this isn't, and we get asked this question a lot. GLP-1s are, I think, a great tool, but they're not necessarily for everybody. And I've certainly had people who I've seen who can't tolerate them. But what are other alternatives? We know there's lifestyle changes, but what are other things that people can do if they don't work? And just kind of what are your thoughts on some of the risks?
Yeah. So some of the risks with a GLP-1 is risk for potential pancreatitis. So if somebody's had pancreatitis in the past, I definitely would not prescribe them a GLP-1 because that's a contraindication, actually. The other group that's a contraindication is medullary thyroid carcinoma, which is a familiar thyroid cancer. I would say I would not give it to anybody who's had a thyroid cancer in the past. So those are the two main people that I would say steer clear of giving them a GLP-1. Definitely, if somebody does have abdominal pain after taking it, severe mid abdominal pain, I would discontinue it because something is happening, either slowing down the stomach. So that's a potential thing that can happen, gastroparesis. And that means that the stomach does not cause the food to flow downward. That could be something that could continue after the medication is stopped. There's also incidents of eye stroke. This is rare. It's like 180 cases, but it's something that can just start to happen. So if you start having blurry vision, I would definitely stop taking the med right away, because that's a non-reversible type of pretty much an eye stroke in the retina.
Wow.
So if somebody can't tolerate the medication, I would definitely consider bariatric surgery. Bariatric surgery actually does increase your body's GLP-1. It decreases something called ghrelin, which is a hunger hormone, and it also increases another fullness hormone called peptide YY. So, surgery has gotten very advanced. I do it robotically, small incisions. People are up and walking within a couple hours after surgery. It's definitely not something that people should feel afraid about, because the mortality rates of doing a bariatric operation is actually lower than taking somebody's gallbladder out or somebody's appendix, which are pretty common surgeries.
Well, and I think this is a question I would certainly have, but is there a difference in, so when I look at the FDA requirements for GLP-1s, or even, there's usually a BMI, you have to have a threshold, either BMI and comorbidities together to qualify. Is it the same for bariatric, or are there differences?
Yeah. So for a GLP-1, I would say if somebody has 20 or 30 pounds to lose, then you can consider a GLP-1, just as long as you have those lifestyle changes that you're doing alongside doing the medication, so that you make sure you don't lose that muscle mass, which is so important for our bodies. And that's actually something that assesses your longevity. Like if you don't have muscle, your risk of dying goes up, definitely.
Wow. Okay.
Yeah, so muscle is super important. For bariatric surgery, it's about 70 pounds overweight
Okay.
or a body mass index above 35. Um, and you could or you don't have to have a comorbidity like diabetes, hypertension, sleep apnea. Those are the indications to have weight loss surgery. The great thing with your company is that you have something called CAREM, which we're actually a part of our practices, where they cover bariatric surgery 100% with no out-of-pocket expenses
Yeah.
for employees, and they even cover travel expenses and
Yeah.
hotel and stuff like that. So it's pretty awesome that Cummins does
Yeah,
this
I
for their
started smiling when you
employees.
said that because
Yeah,
I've heard this before. I'm a big fan of Carum, and I am glad because I do
yeah,
want people listening or watching this to know that Carum is it's and it increases. I think it's very focused on outcomes, and so the better the
yeah,
outcome, and
absolutely.
navigating someone's journey. So I'm really glad that you mentioned that, and I think that's really interesting because I don't think people always know if you are at that threshold where you have 70 pounds or more to lose, and maybe your BMI is over 35, that there you might have
Mm,
alternatives to consider, and
absolutely.
think
Yeah.
about. Um, you know, one of the questions that comes up a lot about GLP-1s is, and I'm not, I mean, I am, I think GLP-1s are great. I think there's a lot of good with them. I've seen them work really well for people. I've seen them not work for people. So I don't want to present any of my questions as being in one direction or the other, but the question that comes up a lot is what happens when people stop taking them, and should people understand that this could be like a lifetime,
Yeah.
maintenance drug.
Yeah. So definitely I see it in my practice, patients losing weight under supervision. I have a dietitian,
Mhm.
exercise physiologist, and we really try not to go too high on that dose when you dose up. You want to stay at a dose where you're losing weight, but you're not losing it too quickly. Like I think that's one important point with the GLP-1s. You don't need to increase it necessarily every month. If you're losing weight at a lower dose, I try to keep it as low as possible. After you get to your goal, I can tell you it's very difficult to stay at that number when you come off of it. And I do see patients a couple months, like the first month is okay. Second month, they start to have the food noise and they start eating a little bit more. And, the studies do show that, most people who come off of it regain about 75% of the weight that they lost. So that's why it's super important to know what weight you're losing. Are you losing muscle weight? Are you losing fat weight? And you need to monitor that closely. Check a body composition every month to really see what your levels are changing. And if you are losing muscle, you need to do something about it quickly. It's either making sure you get that protein, resistance exercise, but also potentially if you need testosterone, because I could tell you if you're a postmenopausal woman and you have zero testosterone, there is no way you're going to build muscle. So you
Wow.
really, yeah, the testosterone is what fuels your muscle. And if you have zero, you will not be able to build it, no matter how much protein, no matter how much resistance training you do. So
Really? That's
yeah,
almost frightening. I mean, that's something to really consider. So can a
absolutely.
woman who's post-menopause, are they a candidate? Can they, if they, under medical supervision, obviously, to be able to take
Get
testosterone so that they can
absolutely.
build muscle? Okay.
Absolutely.
Okay.
Yeah.
That's great to know.
And the people who we see who are on testosterone, because we do it in our practice, they lose a lot less muscle on a GLP-1.
Wow. Okay.
So,
That's
yeah.
really that I had no idea about that.
Yeah.
So, um,
Yeah.
well, when women and I know we're getting close to time, but when as a woman, when you're thinking about metabolic health, um, or you're thinking about metabolic health, your weight, what are should women be thinking about beyond the number on the scale, right? Because again, I come from the
Yeah.
generation, you could be on the scale every day and I need to be this number, but what's really a sign or an indicator of good metabolic health other than that scale?
So if you can have access to like a body composition analysis scale, like a Sika or a DEXA scan, really making sure that, really other than that number on the scale, it's really fat percentage and
Mhm.
muscle mass.
Okay.
So for a woman, if your fat percentage is less than 36%, that means you're healthy.
Yeah.
So I would say that that is definitely important. And then obviously just checking, insulin level, blood glucose, fasting glucose, making sure that you don't have any insulin resistance or pre-diabetic. Those are important lab markers to
Okay.
check too. But one thing with weight loss is, which is really, really interesting, and one thing that I would tell your listeners to check is your T3 level. Your
T3.
T3, that active
Yep.
thyroid hormone, more so than T4, even TSH. If you're losing weight, that enzyme in your body that converts T4 to T3 actually drops. It's called a deiodinase. And so if you don't get replaced for that T3, your metabolism will slow. And weight
Okay.
loss actually shows that it drops that enzyme to convert to T3. So,
That's really interesting. You know what? And I don't know if this is, I'm just thinking of the question. If I was going to get a question from somebody or many people that were to
yes.
listen to this would be, so we know you're based in Austin, Texas. I'm sure there are people who come from miles around, but since not
Yeah.
everybody can do that, how does somebody, I hear now
Yeah.
from a lot of women who can't even find even their normal OBGYN, might not, test for do any hormone
Yeah.
testing. How does
Yes.
somebody find a clinician or a physician like you? Where is there
Yeah.
is there a directory somewhere? I don't think there is.
Well, how we learned hormones is currently we use a company that does pellet therapy. So it's called Avexius. And so they do educate clinicians on hormones, hormone health. I would definitely go to a place that's reputable. I wouldn't go to like the local med spa or something like that because they're not going to necessarily check every single thing. Even though they're a provider through that platform, it doesn't really mean that they do it to the full extent. So really going to a weight loss doctor, you could check also like
Yep.
a board certified, ABOM, which is the American Board of Obesity Medicine certified physician for medical
Okay.
weight loss. Us as bariatric surgeons, we treat GLP-1s almost like we treat bariatric surgery, where we want to make sure metabolic health is good, number one, but we also need to make sure that lifestyle changes are there too.
Yeah.
And that's one thing that we do with bariatrics. We don't just operate on everybody. Is we have a registered dietitian in-house who meets with them, exercise physiologists. We have a gym here. We have labs in-house. So pretty much we tried to create a center here for
Yeah.
hormone health and everything.
So finding a physician who might specialize in bariatric health is probably
Yeah,
a good place to go. That's really interesting and
absolutely.
good to know because I think, especially, I said at the beginning, I think there's a lot of discussion about women's health out there, but I don't feel like, as much as social media will tell you about it, when you're actually sitting down to think about your own health, it's still so confusing. So I think this
Absolutely.
is really helpful, really enlightening. Now, you might have said this already, but I have one final question, which is, when if someone is thinking about um their about hormones, about it, whether or not it's weight loss, but just good hormonal health, is there one thing that somebody can do now, regardless of their age? And we talked about a lot of things, even if you were just pick one of those, is that if you do nothing else, you should think about this. Is there anything you would say?
So for hormonal health or overall wellness, I would say there are some things that we could just do on a day-to-day basis. So I'll just kind of spit out those for you.
Sure.
Make sure you drink 64 ounces of water.
Okay.
You know, I know we tell people 8 glasses, eight ounce glasses.
Yep.
Water is your fuel for metabolism. So
Okay.
if your engine is dry and you don't put gas in it, it's not going to go anywhere. So think of water as like your gasoline. So number one,
Yep.
64 ounces of water. You know, making sure you have enough protein. We already kind of talked about 80 to 100
Yep.
grams on average of protein. Doing some sort of activity, you know, resistance training. It doesn't have to be crazy. It doesn't have to be at the gym with these huge barbells. It could just be 2 5-pound weights and just
Okay.
do, you know, some reps of that. I think all of those things, if you make that as your core foundation, that, and then the other thing is trying to cut out processed foods. You know,
Mhm.
I know that
Yeah.
that one's kind of hard. And if you try to gear your diet towards things that you can actually see in nature,
Yeah.
that would be ideal.
Yeah.
So,
I've tried to limit mine to like ultra processed foods. Like
yeah,
I'm never going to make my own cottage cheese. So you can call that processed, but I'm probably going to eat it. But if I, something that has like ingredients that I can't really, I wouldn't know where to
right,
source them or find them, you know,
right.
maybe I'll start there. So that's,
Yeah,
it's good to hear someone say
absolutely.
that. Yeah.
Yeah, and I think
Yeah.
when you think about it, we don't necessarily have to count every single calorie.
Yeah.
Like I know when I was a kid, I would count all these calories. You'd like you kind of like measure it just based on calories. But if you just
Yep.
base it on macros and just say,
Yes.
okay, I'm just gonna cut down on the bread, the pasta, the rice, you know, and I'm gonna eat complex carbs like vegetables, you know, even beans or quinoa, those are healthy for you. And
Yep.
then good lean protein, if you kind of just narrow it down to these are the foods I'm going to eat, most likely you probably will lose some weight,
That's
even if you
awesome.
don't
Yeah.
count the calories. Yeah,
Yeah, that's great to hear. I think that helps in a sea of all of this information, helps people just really, really narrow it down.
to
So
the basics.
this has been super helpful. And I thank you for taking the time to do this. I know that you have a very busy schedule, so we thank you for taking the time to do that. Um, and I would tell the final note for our listeners is, we encourage our listeners to speak to your own healthcare providers before you make any healthcare decisions. These conversations that we're having, like the one we have just had now today, are really at the heart of what Be Well is about. It's to help you feel informed and supported and empowered to take care of yourself. So that's my message to our audience before we go. And again, Dr. Bassa, thank you so much for being with us today.
You're so welcome, Kate. Thank you for the
Thank you.
invite.
Yeah,
Thank
you're
you.
welcome. Have a good day.
You too. Bye bye.